we're gonna get started shortly. Okay, just want to let you know so you can see me. All right. Okay, cool. It's 6 o'clock. Um, we are going to get started in about 3 minutes. I might shorten that time, but I do have a couple of folks who let me know that they may come in. Give me just a little bit, okay? You're going to hear my wonderful clock in the background. That lets us know what time it is on the hour every hour. All right, I'm just gonna click. Okay, great. Okay. All right, so I'm gonna go ahead. Hello and welcome. My name is Kiana Brathwaite. I am the CEO and founder of KB Calls. And the reason that I chose to do the webinar was because I realized right now it's February and I have not done what I usually do with planning for how to use our healthcare benefits and our resources. And I figured I would just invite folks to hop in and kind of walk you through the process. So last week was the beginning, right? I walked you through how to, just what to look for, the different portals, what they kind of look like through your health insurance. A lot of that information sometimes is on your insurance card. Other times you may have to call and ask a question. And it hopefully is easier because the whole point of being online and providing online access is to provide ease. But that's not always the case. So what we're going to do this week, I have a couple of polls that I'm going to ask. Let's see. Here we go. I'll start with, since today is Sunday, here we'll start with, well, I'll start with the Sunday poll. So, um, there we go. I just shared with you the poll for Sunday. If you could go ahead and answer that, that'd be awesome. And we'll see. Okay, nice. So we got a couple folks that are chilling on a Sunday. Nice. I think that's what you're supposed to do, right? And get ready for, prepare for your week. As we go through the other slides and everything, I will definitely pop up a couple other polls there for you. So I am going to, hopefully you did your homework and you logged into your portal. If not, no worries. I'm going to show you a couple of what the portals could look like depending on who your health coverage is. And these are the ones that I'm going to show you are mostly in the Pennsylvania area. And there's some of the bigger players in PA. So I'm going to share my screen with you real quick. If you cannot see it, please let me know. This is my actual portal, but let's go. So one thing I do like about Blue Cross Blue Shield is I think it's a very nice user interface. Whether you're a member or not, you can really get onto their website and play around and see what it is that they are offering. And I think that's really helpful. It's helpful in making a decision about the usability of the insurance company, how readily available the information is, how much they're willing to share before you even hop on and become a customer. I think that's really important. Another major player in the Philadelphia area is United Healthcare. And again, they provide you with a good bit of information, right? Finding a doctor, popular forms, how to get in contact with them, signing in and registering. It just really gives you an idea of what the company is about. And I'll go into this a little bit more. Cigna, another one of our big players. Also, you can log in. There's some information about finding, providers are figuring out care costs and updating your profile. So they let you know what you can what you can access while you're on their website, and then also how to get in contact with them. And then the last one is Aetna. And I really had to play around with this to get any information from them, because I believe if you go to the Aetna site, and I'll come back, but they really just want to, oh look, now it's doing what it's supposed to do. Yay. So they also provide you with some information as far as being an individual or an employer, whether you're a provider, and then some of their news and careers. So you can bounce around their websites. And I always often recommend this to clients, that when you are looking to kind of audit and decide which insurance provider you're even thinking about, sometimes it's helpful to go to their website and just see how much you can play around with it, and how much information they'll give you readily before you become a paying customer. All right, so this week is really just about getting to know your portal, right? How to navigate your portal. And I wanted to share with you, so the one is, of course, our portal. When we log in, as I said, this is the beginning of the year. I usually am a lot more on top of going through the assessments and, my checklist. I have not done my yearly checkup yet, but thankfully it's February. I still have some time. And the annual flu shot. So I have my own personal and professional information, thoughts on the flu shot. If you are severely immunosuppressed, you have asthma, and even elderly in certain scenarios and situations, I do follow the recommendations of the CDC and other healthcare entities. When you're a little healthier, that's a whole nother discussion I think needs to be had with your healthcare provider, whether that's a nurse practitioner, an MD or a DO, and, really being able to sit down with somebody and voicing your concerns about getting any kind of vaccination. And so you can have a real conversation and get information that's pertinent to you, not just going off of what somebody else recommends or what their thoughts are, because you don't always know where they're coming from and what they're doing with their health, right? So this is the home portal. This is when you log in. This is some of the tools and information that they provide for you. I think it's very helpful to do a couple of things. So there's a few areas that I'd like to focus on here before we move into anything else. So the viewing your card balance, reporting a lost card, that's really important, right? Because identity theft is real. And, if somebody's walking around with your card, they can quite possibly figure out a way to use your benefits and tap into your information and make changes. So you want to make sure that if that card is lost, that you are letting your insurance company know ASAP. It's kind of like if you lose your phone, you call your cell phone company and you cut it off. Same thing with your insurance company. Downloading the explanation of benefits. I actually do a presentation series on the explanation of benefits because there's so much information that comes in that paperwork. It can be extremely overwhelming. But it's necessary to pay attention because you want to make sure that your provider, when they're billing, that they billed correctly. You want to know where you stand as far as your deductible and your coinsurances and your copays are concerned. And it'll give you an idea of what to expect when that bill comes in the mail, if there's going to be a bill, right? So usually your EOB will say that you may be responsible for, your provider may bill you for. There's different wording that they use, but it's pretty much saying, this is what we paid, this is what you paid for copay, and this is your additional responsibility. So that's that. And then ordering a new card, you need to know how to do that. That can be really helpful. Sometimes you can go online and download a card and keep it on your, cell phone as a digital copy. I'm not sure. It depends on your provider if they'll accept that. A lot of times they need to be able to scan it. And they don't always scan it every single time you go, but at least the first initial and maybe the second time they'll want to be able to scan that. Hopefully some of us are moving into the 21st century, but security is really a big issue, HIPAA depending. So making sure that you have a hard copy of your card is always something that I would recommend. They talk about pharmacy, really important if you have regular medications, and overseas assistance if you are planning to travel. And this is even an area that I would look in if I'm traveling state to state. A lot of times your coverage, and you need to have this conversation with your provider, a lot of times your coverage will cross state lines, but that's not always the case. So if you plan to travel, I recommend that you have a conversation with them. And if you're definitely looking to travel overseas, we have, unfortunately at this time, we have people who ended up, hopping on a cruise ship and traveled overseas and had some issues with, and not just with the current crisis with Corona, but, if you get sick overseas, that bill can be a really big bill. So you need to be able to tap in and figure out what coverages you have when you're traveling. That's really important to maintain your health because you want to be able to enjoy whatever reason you're traveling. Hopefully it's business and pleasure, but you want to be able to enjoy them and be productive. They have a lot of wellness resources, and I kind of went over this last week. A lot of times these insurance providers are in the place where they want to move more into a preventative health measure as opposed to just doing the knee-jerk acute treatment and reaction. So they'll kind of reward you or incentivize you for doing preventative care. And I think healthcare.gov has a preventative care link that you could go to, and that will allow you to look into what it is that they're offering and what's covered. And usually healthcare.gov right now is the website that gives you the whole overview. So if your insurance company isn't covering something that's preventative, or if somebody didn't bill it right and you look at that website and you're like, wait, this is preventative. So like OBGYN visits, any kind of visit to your primary, the first annual, or if they're just regular checkups, usually those are preventive. And sometimes you won't have a copay for those. So that puts a little extra money back in your pocket, which is awesome. I love extra money in my pocket. I can do different things with it. So that's the main portal. I wanted to show you just different things that you can hop around in on the website. And this is our insurance carrier. As some of them, they will look a little different, but for the most part, Blue Cross Blue Shield does a really good job of sharing or making sure that you know how to navigate around their website. And I just wanted to pop in. So last week I went over, a lot of times once you log in, the insurance provider will show you, okay, these are the plans that are available, and you'll be able to kind of see which one. And I did mention having your insurance card handy, even if you have a digital copy. Usually it'll show you, okay, this is what your plan is. So it kind of narrows down what you have to do. And really figure out, do I have the standard? Do I have the basic? Do I have the platinum? Do I have the gold? What is bronze? I have no clue. So it just helps you narrow it down so you know exactly where you want to go. Now, this is muy importante. I actually do a presentation on the summary of benefits as well. I call them SOBs because there's just so much information. They call them something else in the insurance world, but there's a wealth of information in your service benefit plan brochure, right? So in the beginning, as soon as you sign up for your insurance, when the new year rolls in, by that time, if they have not sent it to you, please make sure you call your insurance companies because you should have a way to go in and see what your plan options are, what's covered for your pharmacy, what's covered for, if you, I wanted to show you something really quick because I thought this was cool. And forgive me, I'm going to have to bounce around to a couple things, but there was, oh, okay. Okay, let's log in real quick. It logged me out. There was a my account. Here we go. I really appreciate this in the sense of being able to compare. I very much believe in auditing your insurance for the year prior and the year coming up. And this is loading a little slow. So let's see what happens because it came up for me before. Bear with me. I'm going to have to stop sharing real quick and just make sure that this loads. There we go. Cool. I'm coming back to share again. I'm going to check and see if anybody has any questions. Awesome. Okay. So going back into, there we are. And I'm going to, okay, here we go. So as you can see, it gives you the plan option benefits, the visits that were covered for this year, and then it shows you what your coverages were for last year, right? And for me, again, this is the beginning of the year. I haven't really sat down and done my planning, but I noticed something immediately. We had nutritional counseling last year as a plan benefit, and then when I look at this year, it's not there. Now, as I said, I think this is a really great way to do cross comparing because you get to really see, okay, what services did I take advantage of? What services did I not take advantage of? What did they add? And what have they taken away? And because usually when you're going through and you can see here some of the other ones, like I said, this year I'm not on top of things. I'm moving really, really slow this year to get us up and running. But oops, sorry. But yeah, it really gives you an opportunity to truly audit, and then you can see where your dollars are being spent, and if you're truly maximizing your benefits. And do I need to step down? Like, am I getting too much? Am I paying for something that I'm not really using here? Or do I need more? And that can be hard to do at the beginning of the year, or that could be hard to do. But if you have those methodologies where you're looking at those dashboards that are showing you and providing you with that information, then you're making a more informed decision about moving forward with your benefits for the next year. So under the portal, depending, again, Blue Cross Blue Shield does a really good job of putting this information at your fingertips. They'll have a bunch of other tools that you can tap into. They offer WebMD, and I'm a big fan of WebMD. It's just because they vet the people who are on that website and providing you with information. It's okay to Google things, but you really want to have reputable or vetted sources of information, because otherwise you are going to go stir crazy. I usually don't. If I wait till I go to the doctor, and then if they give me a diagnosis, then I do my research. That's just how I operate. I know sometimes people want to Google things, so when they walk in there, they feel prepared, but you're not really sure, again, how those people, what their health levels were, what was going on. They're really sometimes, when they're blogs and stuff, sharing their experience, which is great. But I personally just want somebody who's been vetted and who does research and who can provide other resources behind, what they're saying. So these are just great ways to really get to know your portal. I always recommend go in, click around, play around, mess up, go to places that you wouldn't normally go, even if you're like down here and you're clicking on their glossary of terms or how to contact them. There's so many different in terms and conditions and privacy policy. Get to know the portal. Really get to know the portal. So I'm going to move forward to the SOB or summary of benefits and show you how this can be helpful in also using the information from the visit summary that showed you, okay, this is the number of visits that you have, this is the number of visits that you still have available, and this is what you've used, which goes to the audit, and just checking in with yourself, right? So online, a lot of times they'll have, I just want to go back. I chose the interactive brochure because it allows me to kind of search and really do like a quick snapshot. What did y'all change from last year? What pages do I need to go to look this up? And this is great if you're I had a client who was going to the ER, and while they were there registering, the ER said, "Oh, well, you owe us, you have to pay $250." And it was like, that doesn't sound right, even though it's not on their insurance card what their copay is for ER. They were like, no, that doesn't sound right. So you can go in and type in, and you may have to play around with it, but let's see, emergency room. Right, medical emergency. So you may have to play around with emergency inpatient admissions. You may have to play around with it a little bit, but you can still search it. So if you're at a doctor's office and they give you a code or they're telling you that it costs a certain amount, the interactive one will allow you to search the summary of benefits, and you can pull it up and say, this is what my insurance company has in writing saying that they'll cover. This is what my, whatever is. And you'll have it in writing so you can show it to them. Sometimes it's that the person in the office is just so used to billing it a certain way that that's just what they do. And other times there are so many insurance companies, as I've shown you, that are doing so many different things that it's just human error. So if you have information on your side, then you can advocate for yourself and say, you know what? Bill me. Worst case scenario, bill the insurance, bill me, and we'll work it out. I'll pay my copay or, whatever, what I know my copay to be, and we could go from there because that's all I could do. So I wanted to pop in really quickly and ask a quick question. Oh, Q&A, there we go. Yes. Definitely got to cross compare, right? And you definitely, thank you, Daniela. You have to, you really have to, and it's daunting. I mean, we have so much going on in our lives, but the interactive tool is one of the things that I definitely recommend you getting in and playing around with on, your free 30 seconds that you have every day to just sit around and do absolutely nothing. To really go into that and play around with that. I'm clicking around because I got to find it. Yes, your summary of benefits interactive tool, if your insurance carrier offers that. Just really click around with that and just play with it so you'll know some of the terminology that they use for you to be able to find things quickly if you're in that scenario. So really quick, wanted to do a poll just to see. I know I had mentioned homework. So the poll is pretty much, how was your homework? I'm sharing this with everybody. Please feel free to answer. And if, there's a couple of options there. I would love to see. Yes, homework. What homework? Awesome. I will share as they come up that the homework was for you to log into your portal and really play around with it so that when you came in, you had questions ready for today so that I can go through with you. And I can even, if somebody wants to, if they've logged in, and they want to have somebody kind of help me, you want me to help you walk through kind of your portal. Okay, a little complicated. Yes, so is mine, definitely. I'm gonna show the results. Hopefully they come up. I might have to stop sharing. Let me know if you can see the results, guys. I'm looking for hands up. Let's see. But they're definitely here. All right, a little complicated. Cool. Is there, or does anybody have any questions that they, if you haven't logged in, that's cool. Might you have any questions about logging in, since we kind of haven't done our homework yet, which is okay. And I will say, moving forward, if you log into your portals, now that you kind of see what they're supposed to look like and how to move around them, and some of what is offered from some of the insurance companies, if you have any questions in the interim, and I'll put it in the chat box, please feel free to email me or give me a text. Okay, so here's my email. And here is my cell phone number. Oops, there we go. All right, so you have of those you can copy and paste right out of there. So when is the best time to start this process? Awesome question. I like to start it myself in the beginning of the year because I know it'll give me an idea of where I'm starting. So if I'm gonna go back, I want to show you something really quick. Great question. So as you can see, it tells you where you're starting with your deductible and your out of pocket, right? It tells you how much it's going to cost you to go to these different things and use these different services. And it walks you through, hey, if you're in, if this thing is going on, and I think they're assuming because I may be of reproductive age, that I might be pregnant, but good Lord, no. But you can also check your rewards balances and visit your doctor. I always recommend that once you have your benefits in place, and that's usually between October and December 15th. Some are a little less, some are a little more, that you set up your benefits for the next year. When January rolls around, that you are starting that process of planning, right? And if not planning, just looking at, okay, do I have my card? What other benefits am I offered through my insurance? Do I have a provider in place? Like those things are the things that I would recommend you start with. And then if for some reason some people have, life change events, their insurance, or they change insurance, they get a new job. Anytime there's a life change, you're getting a new position or you're getting new benefits or any kind of life change, I always recommend you go back in to make sure that what the information that you have is relevant to what's going on with you right then and there. Okay. So that's an awesome question. Any other questions about accessing portals or, I want to take it really, I don't want to give you a whole bunch of information all at once because it can be overwhelming. I did want to show you, because I did mention this, some employers offer employee assistance programs. And while I'm talking, please feel free. I'm bouncing between screens just to check and see what questions are being asked. But employee assistance programs are really great because they're separate from the benefit that the employer offers, and they're separate from your health insurance, but they work in tandem. Just meaning that if you have some sort of mental health thing that you're trying to deal with and work through, usually the insurance company that you're covered by, whoever your provider is that you start going to see under your EAP, they're usually in network. I'd say 75 to 85% of the time they're in network, or will be willing to work with you in some way, shape, or form. The health and wellness and health navigation benefits, work-life services, whether that's financial, legal, family, elder care, those are some of the best supplementary or ancillary, as I call them, services, helping you figure out FMLA. If you're an employee and you're getting gruff from your employer about your FMLA, this, having those kinds of ancillary services outside of your employer is always helpful because they're a little less leaning more towards helping your employee and leaning more towards helping you, helping your employer, leaning more towards helping you. And then anytime that your insurance company offers something like Blue 365, which is really just an incentivized program to help you with your health and wellness journey wherever you are in that place, right? So if you're just getting started or you're like super fit and really just want to take advantage of those things, make sure that you're tapping into all the benefits that are being offered. All right. And I just wanted to really quick just go. Yeah, so we went over. Okay, cool. Yeah, I'm in the interest of everybody's time. I usually do this for about 30 minutes just to make sure it's Sunday evening. I want you to be able to get back to your families and really enjoy your Sunday before getting your week started. So I am open to hanging out here if anybody has any additional questions, or if you've logged into your portal, I can also help you. You can share your screen and we can walk through something. If you have any questions, just let me know. Otherwise, you have my contact information. Please feel free, if you run into any snags, to definitely reach out, because I'm more than willing to help you walk through, and we can do like a virtual thing just like this, and I'll, you can share your screen and we can walk through. I can answer any questions. So it's not something that you have to do in front of everybody. You do have the opportunity to do it with me later. All right. Okay. Well, next week we'll go into last week we did just getting started, gathering your resources. This week was walking through your resources, kind of just playing around with getting to know and navigating. And then next week will be kind of nitty gritty, how do I do a provider search, or, just really diving into one particular area. It could even, I can walk you through kind of planning what you're working out your deductible and how to figure that out. So yeah, I think next week will be definitely let's do the provider search. If you don't already have somebody on board, really delving into the portals. And then the following week, we'll kind of work through the planning aspect. Now you've really gotten familiar with the platform. You've logged in, done the troubleshooting. You know what your resources are, and let's plan out what the year is going to look like. Who you need to see and how you need to plan that out. So right at the 32 minutes, which is great. I wish you guys a wonderful week. Thank you for joining me. I really appreciate it. And the questions were phenomenal and amazing. And I'll see you guys next week. All right. Take care.